Hi, everyone. I'm Dr. Samantha, the maternity mentor. Welcome back to another one of our live Q&A sessions that we have here every Monday at 9 p.m. Eastern Standard Time. This is our chance to interact with you guys live and to answer any questions that you have while we're talking, as well as any questions that you may have submitted onto our videos. Please remember, we're also on Facebook, Instagram, and Twitter for additional content. We always link those into the description, so you can check us out over there. You can also ask us any questions you'd like to ask over there. And please remember that you can also give us any suggestions for videos that you might want to see in the future. And at the end of this, I'm going to try to give you a sneak peek as to what tomorrow's video is going to look like. If you can, please hit the notification bell, subscribe to the channel. It really helps us out and we really appreciate it. So again, please feel free to put any questions that you have into the chat. And I'm going to go ahead and I'm going to start with some questions that we've received on our videos this week. So we get a lot of questions about bleeding, and I know this is like a really scary thing for a lot of women. So I want to start with that tonight. So the first question is, for 9 weeks, I've had nausea and vomiting. I thought I was pregnant and took a home pregnancy test, but it showed negative results. Yesterday, I got a brown discharge, and today the discharge was brown with red bleeding plus vomiting. I don't know what this means, as this is the first time that I'm experiencing this. So this is a really great question that this viewer brought in. One of the first things that I'm going to tell you guys is that if you think that you might be pregnant, it's very important to go ahead and take that pregnancy test as soon as you possibly can. If you are pregnant, there's a whole bunch of things that you really need to address right away. For starters, if you are not already on a prenatal vitamin, you need to get on a prenatal vitamin right away, because there's many vitamins that are essential for that early development of the brain, heart, lungs, spinal cord, with the most important being folic acid. When we're folic acid deficient in the early part of our pregnancy, it can actually lead to spinal cord deformities, as well as possibly even brain deformities in your baby. So it's really, really, really important that if you suspect that you might be pregnant, to try to figure that out right away. Additionally, you might be somebody who uses alcohol, drugs, or tobacco during your pregnancy, as well as THC and marijuana products. So there's a lot of risks to a lot of these medications and using some of these, these substances and using these substances during your pregnancy. And we have a video on alcohol and caffeine that we'll link into the video. Nicotine can lead to a whole bunch of different issues with your baby, including small for gestational age, which means the baby doesn't grow as well in your belly. Too much alcohol can lead to fetal alcohol syndrome, which has long-term consequences on your baby, including learning disabilities and low IQ. You can have caffeine, of course, but sometimes that will cause some issues with like growth as well. The final one is now marijuana, THC. So marijuana for the longest time was kind of lumped in with illicit substances. You can't use cocaine, you can't use heroin, you can't use stuff like that during your pregnancy. It's contraindicated. It can cause a lot of birth defects and issues. It can also cause preterm birth, miscarriage, stillbirth, right? Marijuana used to be lumped into that category, but now, as many of you are aware, many of you may be in places where marijuana is now legalized. This creates a very confusing kind of paradox for women. So I am personally a provider who thinks that there's a lot of benefits to medical marijuana. So let me start by saying I need you to understand it's medical marijuana. The stuff that you are buying from somebody's backyard or on the streets can be laced with a bunch of other substances that are not healthy for you. Medical marijuana is regulated and it's given to dispensaries in order to sell legally. Now, medical marijuana has a variety of benefits. And for those of you who are going to say it helps with morning sickness, it does actually help with morning sickness. However, that being said, I am completely 100% opposed to the use of marijuana and medical marijuana, as well as any THC products during pregnancy or while you're breastfeeding. I have read the studies, and there are numerous studies on the effects of THC and even CBD to an extent, but THC specifically on the development of a growing baby's brain. Okay. This substance can cause significant long-term impacts that will far outlast what we even know right now. So even though you may live in a state where it's legal, even though it may help you with a variety of ailments during your pregnancy, including pain, nausea, depression, anxiety, sleep, I do not recommend it. I do not agree with it, and I do not think you should use it. Going back to this person's question, she thought she had been pregnant and she was 9 weeks and didn't take a pregnancy test until she started bleeding. So the thing is that you might use medical marijuana for a variety of reasons when you're not pregnant. For example, anxiety or sleep, which I think is actually great. But if you suspect you might be pregnant, you need to know that right away so you can choose what you're going to do and what you're not going to do. So if you think you're pregnant, please take a pregnancy test. Now, for this person, once she started bleeding, she took the pregnancy test and it was negative. So the thing is, you may unfortunately have been experiencing a miscarriage, and the HCG levels that pregnancy test is looking for were no longer detectable. So you might have been pregnant for 4 to 6 weeks, and then you are now having a miscarriage. For those of you who don't know, HCG is human chorionic gonadotropin, okay, HCG. This is the hormone that we test both in the urine and the blood in order to determine if you're pregnant. So what'll happen is if you are having a miscarriage, you might still test positive in your urine test. The only way for us to know whether a pregnancy is sustaining itself when you are bleeding is to do serum or blood tests for HCG. What we do is we do one blood test, and then in a couple days we do another one. If the HCG levels are going up, then that's a good sign that the pregnancy is going well. If the HCG levels are going down, then that's something that may indicate to us that there's a problem and you may be having a miscarriage. So I see we already have a question in the chat, which I love. So, can I continue breastfeeding during pregnancy and after breastfeeding both children? Sorry, it's like a little covered. This is a great question. I love this question. So what she is referring to, or what they are referring to, is tandem breastfeeding. This is when you're breastfeeding 2 children at once and then breastfeeding during pregnancy. So the first thing you need to be aware of is that breastfeeding during pregnancy is not contraindicated. It is actually safe to do so. There are a few exceptions to this. So when you breastfeed and you stimulate the breast, it releases oxytocin. Oxytocin is the milk ejection hormone. This is the one that says send out the milk. This is the same hormone that causes uterine contractions. So some women will report that they feel cramping when they are breastfeeding while pregnant. So the thing is that this is something that you have to weigh the pros and cons. If you're at risk for preterm birth, if you are already dilating, okay, if you've had previous preterm labors, if you've been bleeding, these are all reasons why it may not be safe for you to continue to breastfeed. However, if you're having a normal, standard, healthy pregnancy with no real complications, there are many women who go on to breastfeed the entire time. So this becomes a discussion with you and your healthcare provider. However, it's not just a flat out no. Now, second part of breastfeeding while pregnant. Even though you may be breastfeeding exclusively and have a full milk supply, many women will have their full milk supply dry up and turn into colostrum around 6 to 7 months pregnant. So when you're just pregnant on your own without making milk ahead of time, around 6 to 7 months is when the colostrum starts to form in the breasts. And this is there for the newborn baby when the baby is born, full of all the antibodies and all that good stuff, right? So a lot of times when a woman is breastfeeding, that breast milk will turn back into colostrum. The reason why this is important is that sometimes babies who are breastfeeding currently will actually wean themselves. They'll actually stop breastfeeding because the colostrum tastes different. It is a different texture, and it definitely is a different quantity. So your baby may self-wean at that time. The other thing you need to know is that your milk may not completely dry up, but the supply may tank. It may go down a lot. So if you are breastfeeding a baby while pregnant, you need to make sure you're keeping track of that baby's pees and poops and weight. You need to make sure the baby's not becoming overly lethargic, that the baby still has a lot of energy and looks good, because it is possible for the baby to actually start to lose weight and become failure to thrive if you don't have a breast milk supply to support them. Now, post-birth, most women will not have a full milk supply. They will have colostrum. If this is the case for you, this means the newborn is the priority. The newborn has to eat first, always, 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 always. And this becomes very challenging for a lot of women. But if you have to, you need to let your older child be away from you in another room while you breastfeed, because that newborn baby needs all of the priority of the milk. So I usually tell moms who are going to tandem breastfeed to give the newborn both breasts, like 10 minutes, or 15 and 15. After that, you can bring in your older child to breastfeed. Now, the nice thing is about this is that the older child is actually going to help to stimulate your breast milk faster. So you may actually get in breast milk and a full supply for that newborn right away. Once that happens, you can breastfeed both of them however you want. A lot of moms, what they'll do is they'll go ahead and they'll have a newborn breastfeeding on one side and the older baby or toddler on the other side. And the next feeding, they'll switch, so that the breasts are getting even stimulation throughout, because each child will have a different suck. But that's a really good question, and I love that you're asking it. Hey there. So is cefuroxime acetal, safe to take for a UTI at 26 weeks? Yes, this is a safe medication to take during pregnancy. And actually, I have I'm wondering if it's you, but I definitely had a question tonight. It is you. I saw this here. So yes, this is a safe medication to take. So I love talking about antibiotics. So this is one thing I think is very important. So antibiotics are designed to treat your bacterial infections, and urinary tract infections are the most common bacterial infection a woman will have during her pregnancy. Now, when you take an antibiotic, we all get really nervous when we're pregnant, because we feel like, there's the baby in there and I don't want to expose the baby to something unnecessarily. And that's very valid, right? Your job is to protect that baby that's in your belly. So a lot of women, what happens is they get this infection, they agree to take the antibiotic, and they start taking it. And within a couple days, at the most, you feel amazing. You feel like totally different. And then moms will stop taking it. Please, please, please do not do this, moms. What happens is the antibiotic kills off the front line. It kills off like 60 to 80% of the bacteria right off the bat. That's why you feel better. But about 20% of that bacteria is holding back. And that bacteria is watching what's going on, and it's building a defense against this antibiotic. Now, if you continue to take it throughout the whole term that you've been given, that bacteria doesn't stand a chance. It's going to be killed and you're going to be infection-free. But if you stop when you start to feel better, that bacteria back there has a chance to build up a wall or a defense against this particular antibiotic. Then what happens is they start to multiply. And in a couple more days, maybe by the end of the week, you're feeling bad again. So now you think, I'm going to take the antibiotic, but this time it doesn't work. And now we need to give you a stronger antibiotic. And the cefuroxime is actually really, really safe, really effective, a really good medication to start with. But as we go down the line with some of these other antibiotics, they become more and more risky, which is why I'm so adamant about moms. If you decide to take an antibiotic, please take it to completion. Great question. Hey, Tess. So you may have said, but what are the signs of, a baby self-weaning? So no, I did not say. So a baby self-weaning in the case of tandem breastfeeding is extremely obvious. It's pretty quick, and they are just refusing the breast and trying to get milk somewhere else. They'll cry at the breast, and that's actually a very common sign of self-weaning when your milk supply is low, is that babies will cry at the breast. If your baby who was breastfeeding before all of a sudden will not latch and just sits there and cries, they're telling you something's off. And actually, if your baby ever does that very consistently, especially if they only do it on one side versus both, you want to actually go to your healthcare provider and get that checked out. That can be a sign of a medical issue in that breast. Other signs of self-weaning, honestly, lack of interest. They start to be more and more interested in regular food, and they don't seem to really care. Some moms, it's kind of subtle, and what moms will do is they just won't offer, and they see what the baby does. When my daughter was breastfeeding, she was about 9.5 months when we stopped, and she had bitten me a couple times, and it got to the point that she bit me and I bled. And I was very frustrated, and none of the tricks worked. And so I stopped breastfeeding her, and I didn't know, I guess, how long I was going to stop breastfeeding. I knew I was in a lot of pain, and I stopped, and she never asked for it again. Like, she just didn't care. And that's when I realized, like, she was done breastfeeding. So it's kind of one of those things, you got to feel your baby out. But, usually it's just more and more refusal, lack of interest. They start to breastfeed less and less and less, and they're just telling you that they're done with it. The only big thing you guys want to be aware of is that when a baby is breastfeeding for nutrition, they have those really nice sessions. They can be quick. They can be as short as 5 minutes. But this baby has a nice, good rhythm and suck, and you can hear them swallowing milk, and you can hear little bits of gulping, and they'll burp afterwards. They might have little bits of like spit up, but they've got a nice little flow, and you can feel a breast empty to a certain extent. Like, your baby is eating for nutrition. If your baby is coming on to latch and they have this little teeny tiny, very passive, very soft, suck, like, and they're not a newborn. Newborns are a whole different story, but you're talking about an older baby. They're just like, that is probably a baby who's using you as a pacifier. And you may want to consider letting them have a pacifier, because otherwise you may be breastfeeding them to sleep for a while. And we have a video on using pacifiers, and we will link that into the description. Hi, Leslie. I'm due on the 16th of November. How can I prevent tearing? This is an excellent, excellent question. I'm going to tell you that there is not a lot that you can do, unfortunately, but the very biggest thing is perineal stretching and perineal massage. And we have a video on that. But basically, you can use like coconut oil. Coconut oil. It's like kind of solid, and it'll kind of spread out. Some OBGYNs say primrose oil, but that one you need to get approved, because primrose oil can also kind of help ripen the cervix. So, you're due on the 16th of November. I'm guessing your OB or midwife wouldn't care, but primrose oil technically can help ripen the cervix. So you want to make sure you get the approval. But basically, you can just use that, and you kind of lubricate it onto the perineum, and you can kind of spend some time with 2 fingers, and you kind of insert it into the bottom of your vagina and push down, and then kind of rub and hold and rub and hold. And you just go back and forth very gently. Okay. Now, you also can get your partner to do this for you. So a lot of you, and some women are a little scared by this, but actually you can find a lot of great YouTube videos that will actually demonstrate it for you. The other thing is, if you have a really cool midwife or a really cool OBGYN and your partner's game, you can actually go in and ask them to show your partner how to do it. There's plenty of partners who actually do this for their pregnant partner, because it's really hard for you to see down there. And it's very gentle. And you can guide them as far as if it's uncomfortable, but believe it or not, they can see what's going on. And if the provider shows them how to do it, they can actually do a pretty effective job for you. Partners actually really like to be involved. And, I think we think of vaginas as only sexual things, but I have found when I have been working with dads a lot in the hospital, that they're really, really wanting to do whatever they can to make their pregnant partner like happy. So dads will shave like vaginas ahead of time because women don't want to like have a hairy vagina, which is fine if you do. We've seen plenty of them. They'll shave legs, they'll do all that stuff. And they just look at it as like something that they really feel like good about because they're trying to get their partner to feel comfortable before labor. So I would really actually encourage you to, you know, potentially look into doing that. But ultimately, Leslie, most of it is about perineal massage and perineal stretching. Okay. The other thing is that's a big thing for preventing tearing is being able to labor down naturally. So you're not pushing when you're at +2. So when you're talking about station, right? So there's a point where you're basically at the cervix that's like 0, and then -1, -2, -3, -4, -5. -5, the baby's head is way up into your uterus. And then it's +1, +2, +4, +4, +5. +5, the baby's head is out of your vagina. Okay. So what we should do is we should let you labor down to like +3, +4. But a lot of times you'll be at like +2 and they'll start having you push. And that's okay depending on what your cervix feels like and different things. But if you can be allowed to labor down naturally, allowing the baby to come as low as possible, with each contraction, what happens is the baby's head kind of pushes against that perineal skin and also stretches it. And then ask your OBGYN or your midwife, are they going to use mineral oil when you go to deliver? So in the hospitals that I worked at, we always had mineral oil in the labor room. And what they would do is they're going to wear sterile gloves and they would cover their glove with the mineral oil. And then they'd also help stretch right as you were pushing. So ask your provider if they're going to do that. And if they hadn't really thought about it, which is okay, ask them if they're willing to do that while you're giving birth, because these are really important things to also help prevent tearing. So I hope that answers your question. For those of you guys who are joining us, please feel free to ask me any questions that you have in the chat. For those of you who I answered your questions, if I didn't answer everything, please let me know. I had a couple other questions that were really good this week. So I had one on pain meds after a C-section. So I'm scheduled for a C-section, and I was wondering how the strong meds after birth will affect the baby as I plan to breastfeed immediately. So I really like answering questions about pain medication. I used to do it all the time in the hospital. And I'm actually going to be doing a video in the future on this because I think it's a really great topic, but I'll get a lot more specific. So here's the bottom line. First thing is, if you've had a C-section, you have had surgery. So we're going to be giving you pain medication during your surgery. A lot of people think we just do that epidural or spinal, right, in the back, and you don't feel anything, which you don't, but that it's just numbing and there's not pain medication involved. There is absolutely pain medication involved with that as well, because they already know that when you're coming out of surgery, you are expected to have some pain. So we want to take care of that, right? So you're going to go ahead and you need to understand you're receiving pain medication as you're delivering. Now, afterwards, you're likely to get some pain medication in an IV, and then they'll switch you over to pain pills. These pills oftentimes are narcotics. They have codeine in them. You'll hear about morphine and different things. So a lot of people get really nervous, right? They're like, oh my God, I don't want to take this. What about the baby? Number one, this is what I say. If your baby needed surgery right after delivery, would you let them give your baby pain meds? And the answer would be yes. You would let them give your baby pain meds. Of course, they're going to give them at the doses that would be safe for your baby, but you wouldn't want your baby to be in pain if the baby needed surgery. And these pain meds that they're giving to you are the same meds that they would give to the baby. Now, you're going to say, oh, but Samantha, I'm getting this big dose. They would get a little dose. Well, remember, you don't have a full milk supply after birth. You have colostrum. It is significantly smaller. It is much thicker, okay? So you have just little teeny tiny bits of milk, which is normal. So you are not possibly going to give the baby tons and tons of pain medication because you just don't have tons and tons of milk. In addition, Part of the way we determine whether whether any medication is safe for breastfeeding has to do with the molecule size and the fat solubility. So let me explain. In order to get into the breast milk, the medication has to go from like a little teeny tiny blood vessel, and it has to go over a membrane into the milk duct where the milk is. So it has to cross through a barrier. Now, every like vessel and stuff in your body, these membranes and stuff, they have little teeny tiny microscopic holes, right? But there's still a hole. It still has a size to it, okay? So if the hole is this big, but my molecule size is this big, it's not going to get through. Now, if the hole is this big and my molecule size is this big, it's going to come in, right? So when we look at some of these meds to determine if they're safe for breastfeeding, we also look to see how much is even going to be able to pass through. And then, of course, there's fat solubility. So you can get some meds in there, but it needs to be able to attach to the milk to kind of get through to the end, which is the baby. And if something is fat soluble, it's more likely to attach to the breast milk because breast milk is full of fat. So when it's not fat soluble, it tends to not really attach to that milk. So what ends up happening is it kind of sits here and eventually it just runs out of strength because there's something called half-life. So I think it's very important for you to realize that we are not going to offer you a med that's not safe for breastfeeding, because we know so many women will try to breastfeed during that time. And it's also very important for you guys to know that if your pain is not under control, it will be hard for you to make breast milk. This is another fatal flaw that I see. So if you've had a C-section or even a vaginal birth, you should expect some pain. I know everybody says there shouldn't be pain. We live in a society of pain meds. I'm going to tell you right now, you should expect pain. So pain scale, 0 to 10. 0 is no pain. 10 is the worst you've ever felt. You think you're going to die and you're just crying and sobbing and on the floor. Okay? That's your scale. With a C-section, you should expect a 2 to a 3. With a vaginal birth, I would expect a 1 to a 3. This is what I would consider to be normal pain after these types of deliveries. Now, when we're talking about medication, please do not wait until you are a 9 or a 10. See, we expect a 2 or a 3. So when we're giving you pain medication, our goal is to get you back to a 2 or a 3. That's what we want to do for you. If you're all the way at a 10, I can't get you to a 2 or a 3. It doesn't matter if I give you the strongest medication I have available. If you're at a 10, I'm getting you to a 5 or a 6. I might even only get you to a 7. And then you have to wait for many hours before I can give you medicine again. But if you ask at a 5, I'm likely to get you back down there. Why is this important? When you are in pain and you think you feel like you're going to die, which is what it feels like at a 9 or a 10, you're like this. You're tense. You're tight. You can't talk. You don't want to move. You don't want to get out of bed. You don't want to do anything. You don't want to eat. You might even be throwing up because you're so nauseous from the pain. Do you think your body can possibly make breast milk if you're in that amount of pain? You got so much cortisol, so much stress hormones going on, your body just can't do it. It's just working on the pain stuff. So please, please, please take pain medication. It's there for a reason. If you have friends or family having babies, please, please, please tell them to take pain medication. Okay? It's not what we expect. It's not this terrible, awful thing. Okay? And if you're taking pain medication because you're in pain, you will not get addicted. We get addicted to pain medicine when we're taking it for something other than pain. Would you also recommend doing exercises or stretches for someone with a low-lying placenta? That is a great question, Bree. So, placentas, for anybody who doesn't know exactly what she's talking about, right? So the placenta is the organ that feeds the baby. So we have a uterus. This is our placenta. It attaches to the side of the uterine wall. This side has a whole bunch of blood vessels that attach to the blood vessels of the uterine wall. And then the umbilical cord comes out, and the umbilical cord brings nutrients in and takes out toxins. Okay, so that's how that works. Normally, the placenta sits on the side of the uterine wall. So it's out of sight, out of mind. We're good. We don't really worry about it. But sometimes we have something called a placenta previa, and we have a video on that. I'll put that into the description. So at the bottom of your uterus, right, you have the cervix, okay? So here's our uterine wall, here's our cervix. A placenta previa, a complete previa, is where you have the placenta completely covering the cervix. A partial is where it's partially covering. And then the low lying is what she's talking about. It's like right next to it. Now, the thing is, sometimes with a low-lying placenta, as the uterus expands and gets bigger, that low-lying placenta will migrate up and it won't become much of an issue. It'll just kind of resolve, is what we say. So the question is, do you do exercises or stretches? Well, the thing is that with a low-lying placenta, our biggest issue is bleeding. So what happens with these placenta previas is, remember, this is all blood vessels, okay? So when the placenta detaches from the uterine wall, right, after we've given birth and it's coming out, this is the biggest chance when you might bleed, because all of these blood vessels get exposed and all of these blood vessels get exposed. So we can't have that placenta detach early because that's a medical emergency. So you actually have to be very careful with a low-lying placenta as to how much exertion you put on it. What I'm going to tell you, Bree, is that this is something that is usually based off of your placental position, as well as how many weeks gestation you are, as well as was it originally a complete and it's been moving, or was it always low lying and it's just stayed there? There's a lot of different things involved with this, but usually mild exercise and stretching is okay. But I would definitely ask your healthcare provider whether they're telling you it's good or not. However, with a low-lying placenta, if they have not sent you to maternal fetal medicine, which are the high-risk doctors, I would ask them to send you to high-risk, because ultimately the high-risk doctors do way better ultrasounds, in my opinion. They're way better at reading those ultrasounds, and they're way better at taking into account a lot of different subtleties about your pregnancy to help you make like really educated decisions. For those of you who are joining us, hi, I'm Dr. Samantha. I'm the maternity mentor. Welcome back to one of our live Q&As that we have here on Mondays at 9 p.m. Eastern Standard Time. For those of you who stay on until the end, I will give you a sneak peek at the video that we're going to be having come out tomorrow. I'm going to get back to some of the questions that we have. Please feel free to keep putting questions into the chat. So I had a question about urinary tract infections. So we had a question earlier specifically about cefuroxime being used. This one was, I'm 7 months pregnant and I take Biogesic and a medicine for the UTI. Now, she didn't really say much more, but I believe that she's basically asking me if she's able to take these meds. So Biogesic is not a medication we use here in the United States. So I looked it up. Biogesic is a combination of a Tylenol, which is safe for pregnancy, and a medication called phenyltoloxamine. Okay, so I looked up phenyltoloxamine in the guide that we have that determines safety for medications, which we use Thomas Hale's book. And Thomas Hale rates the safety of medications. He's a pharmacist. He's really good at what he does. So this medication is considered an L3, which means it's risk versus benefits. This is an antihistamine. And so antihistamines are tricky. And so I'm going to tell you that I usually do not recommend antihistamines unless we have a mom who's experiencing severe insomnia and we're trying to use something mild to help her sleep. So antihistamines are stuff like Benadryl, Vistarol, and this particular medication. Antihistamines are designed to dry you up. Okay, that's very important that you understand that. You know, they're normally used for allergies, and in allergies, we get really congested. And so these dry you up. Well, antihistamines that dry you up, one of the things they're going to do is they're going to dry up your milk supply. Okay, so it's very important for you to understand that when you're taking something like this during pregnancy, or postpartum, you're very likely to be drying up your milk supply inadvertently, and that can become an issue. So you really don't want to take Biogesic unless it's the only medication that's going to work for your UTI. But it sounds like it's being used for pain, and I think that probably regular Tylenol might do the trick for you. The next question I got was it was on my yeast infection video. And it said, in my 4th month, I have yellowish discharge with fishy smell, sometimes itching and burning too. I'm getting weird thoughts too. What should I do? Okay, so yellow discharge with a fishy smell, that is bacterial vaginosis. To confirm that, you need to go to the doctor, and they're going to do a swab to test that discharge. So let's talk about discharge in general. There is normal discharge, and I actually have a video on discharge that we can link. There is normal discharge that you're going to find, right? But some of the discharge is something that needs to be addressed and some isn't. So for starters, you have regular kind of clear discharge. This is usually just kind of like the normal vaginal kind of mucousy stuff that we see. When you have gray, yellow, green, these are all signs of infection, okay? And most of these infections are bacterial, and we need to go ahead and we need to get those treated. Bacterial infections that are left untreated can lead to preterm birth, miscarriage, and stillbirth, okay? A white kind of chunky discharge is usually a yeast infection. Those also can lead to preterm birth, stillbirth, and miscarriage. You need to get them treated. A lot of women take some of these things for granted. They don't realize because under normal circumstances, it's just not really a big deal. But during pregnancy, this invades the tissue of the vagina and it can get into the uterus, and that's where it causes an issue. The other thing you guys need to realize is that sometimes women get a little embarrassed. They're not sure like how to approach it. They're scared. They don't know what's going on. So like, for example, bacterial vaginosis, that's not a sexually transmitted disease. Well, okay. Bacterial vaginosis basically can happen from lack of hygiene. Okay. It's kind of like one of those things that your partner might kind of get a lot of bacterial growing on their parts, or you might, and that can cause this. But it's not a sexually transmitted disease per se. So it's something that can just happen, and it's so easy to treat with an antibiotic. So we should just get it done. But if you have any question about discharge you're having, please go. We just swab you super quick, send it to a lab. The lab tells us what it is and how to treat it, and then we can get you feeling better fast. Hey, Stephanie, if I had a 3rd-degree tear for my first baby, should I have a vaginal delivery or a C-section for the second baby? I also have gestational diabetes for the second pregnancy. Stephanie, I feel for you with that 3rd-degree tear. Those are really, really rough. We have a video for those of you who are interested on vaginal tears, like perineal tears and stuff. And I think it's in the chat already. So when we're talking about 1st degree, 2nd degree, 3rd degree, it has to do, and then there's a 4th degree, it has to do with basically like how deep into the tissue that it gets. By 3rd degree, you're talking about a significant tear that involves a lot of repair. And then we have to give mom a lot of different stuff to help her go to the bathroom so that she doesn't like tear open again. Okay. So Stephanie had a really rough ride. And it's very important to support moms that experience these kinds of tears because they are very traumatizing. They're very, very painful, and the recovery time can be a lot. So normally I'm thinking about how I want to answer you, right? So normally I almost universally say a vaginal delivery. Okay. Cesarean sections have risks to them. You can Google, it's easy to find. I'm sure I mentioned risks throughout some of my videos on C-sections. I have a lot of them, right? However, a scheduled C-section is one of the most fabulous deliveries a woman will ever have. So any of you who are getting a C-section and scheduled, please don't think I'm dissing them because they are fabulous. Like they're planned, everybody's there. We have a room for you. It's awesome. It's like kind of less stress in a lot of ways. But vaginal deliveries tend to be safer for a mom. less risk of bleeding, you don't have any surgical complications, stuff like that. However, if your delivery was particularly traumatizing, many women will experience PTSD after a traumatizing birth. This is something we don't talk about as much, but it does exist. And Stephanie, if your delivery has left you with a lot of potentially emotional fears related to this, I would consider very much whether a scheduled C-section might be better for you. Now, understand it is very different. There is different types of pain involved. There's different types of recovery. So I don't like to sugarcoat that a C-section is somehow easier. But what most people don't understand is that sometimes, even though it may be more painful, longer recovery, more risks, sometimes trauma is far worse. I would encourage you, Stephanie, if you are potentially experiencing some trauma from your first birth, that you try to get in with a counselor, especially if you're early enough for you to kind of talk through some of it to see if that will help glean some understanding or possibly help you make a decision. Now, gestational diabetes, I understand why you're asking that. For those of you who don't know, gestational diabetes is a condition that the baby ends up usually being large, a large for gestational age baby. And these babies, there's some risks during the delivery, including, the baby being so large that the baby you end up tearing significantly, or you end up with a shoulder dystocia. So what I would tell you, Stephanie, is you want to make sure that you're keeping track of the baby's weight, which I'm sure they're doing that through ultrasounds and stuff. And if they are measuring the baby particularly large, especially larger than your last baby, you may want to consider the C-section for that reason. You also want to ask them if they might be able to induce you early. That's sometimes an option, sometimes not. Yep. So Stephanie reports that she's worried about permanent incontinence if I have a bad tear again. Yes, I can imagine why you'd want a vaginal, but you can't imagine living with that. You are absolutely right, Stephanie. It is a very, very, very challenging decision for women who've had a 3rd or 4th degree tear. I don't know if you did pelvic floor therapy. What I would tell you is I would look into pelvic floor therapy and maybe even have a pelvic floor assessment prior to delivery, maybe to see how strong your muscles are right now, what things look like, maybe also be referred to a urologist. Like, really get all these specialists in a row and see where things are at. I would ask them to be doing regular ultrasounds on you to see where, the baby's size is at, and really get your entire team together. The other thing is you can always, if you can get induced early, I would definitely ask to get induced at 39 weeks to help avoid an extra week of the baby growing. And if it doesn't seem like it's coming to play, have the C-section. I would look at I have a ton of videos on C-sections, guys. So if you want to know all about a C-section, please go in there. I have a video on how they prep you. I have a video on what the OR looks like. I have a video on what the first 3 hours after delivery looks like. Like, I have it all laid out. So Stephanie, take a look at those. My videos can be the start to you being able to ask questions and get stuff answered. But I do understand what you're saying. And, if this baby is going to be larger than the last one, it is probably a real consideration for you to have a C-section. That was a very great question, Stephanie. And I appreciate you being so honest, because it's a very important topic for a lot of women to talk about, and we don't talk about it that often. I'm going to ask another question or answer another question, but please feel free to keep putting stuff into the chat. I got a question this week that was very interesting. What about drinking kombucha and breastfeeding? I believe it has 0.5% alcohol. So kombucha is a drink that a lot of people drink for a variety of reasons. So there's a couple of things. So I'm going to start with kombucha and pregnancy. You are so welcome, Stephanie. Kombucha and pregnancy. It is not recommended to drink kombucha while you're pregnant. Okay, kombucha contains caffeine and alcohol. and it's a very acidic drink. On top of it, there's a risk for bacterial contamination. And for these reasons, we do not recommend kombucha while you're pregnant. Period. End of conversation. Okay. Now, when it comes to breastfeeding, things get to be a little bit of a gray area. So let's start with caffeine. There is caffeine in kombucha. It varies from kombucha to kombucha. What most experts say is that we recommend that you use a kombucha that's kind of like professionally manufactured. And so it's kind of being monitored versus somebody's homemade stuff. Okay. The caffeine that's in kombucha, if it's accurate to the label, is not enough to really be a super big impact to your baby. However, I want you guys to remember that when you intake something, it's going to hit your breast milk about 3 hours later. So if you have some kombucha at, say, 8 o'clock at night, at 11 o'clock at night, you're feeding your baby a dose of caffeine, which means your baby may be up all night. Same thing goes for pumping. A lot of people don't take this into account. For moms who like to pump, but they take melatonin, one of the things I tell them to do is label that milk melatonin milk so they can give that when the baby's about to go to sleep. If you're drinking coffee in the morning, and let's say you're going to go ahead and pump while drinking coffee, I tell them to label it coffee milk so you can give it when you expect the baby to be awake. Do the same thing with the kombucha, or consider it when you're drinking it. Now, the alcohol. This person is correct. The alcohol content is extremely low in kombucha. You are allowed to drink alcohol while breastfeeding. Okay, this is something that has changed. Used to be back in the day that we said no, and what we were finding was a lot of women were stopping breastfeeding because they thought that they had to not be able to go to a wedding and enjoy themselves or have a glass of wine or whatever. So here's the thing. Basically, you can drink a serving of alcohol and then 3 hours later you can breastfeed or pump. That's kind of the rule. Now, what does this serving mean? It means you need to go online and you need to figure out exactly what a serving size is for the alcohol you're going to be drinking. There is no, I'm going to have a glass of wine. Chug, 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 chug. No, you actually have to measure it out. And I can't remember off the top of my head. I think wine is 6 or 8 ounces. Okay. But you need to know your serving size and it needs to be measured exactly. And then you drink that wine. It's fine. 3 hours later, you can go ahead and you can breastfeed again. If you're pumping, same thing. The exception is if you feel inebriated. If you feel like you're getting a buzz or you're drunk, you need to pump and dump until that feeling is gone. So that's how you drink alcohol safely while breastfeeding a baby. The same rule should apply to the kombucha. Make sure you're drinking just a serving size. Now, the final thing with breastfeeding is the contamination. So kombucha can contain harmful bacteria because it is not pasteurized. And this bacteria can infect the breast milk and can transfer to the baby. So, placenta pills. This is one of the latest things that's come about in the last several years. Placenta pills have been touted to be used after delivery to help combat postpartum depression and other mood disorders, as well as help anemia and other things. I am pretty homeopathic. I like a lot of alternative medicine. I am also against placenta pills. So what a lot of people don't realize is that these unregulated pills have a lot of risks to them. For starters, there's not a lot of big pharma companies that do vitamins and stuff that are doing placenta pills, which means when you actually look at how some of these are made, you're finding that these are made in somebody's kitchen that has not been necessarily sterilized or any other things. And so you don't know for sure if it's been cleaned to a point that is safe to give yourself this medication. There could be germs. Was it cleaned from somebody else's blood? What you got to understand is even if it's in a lab or some kind of facility that's meant to do just this, if they aren't being regulated or monitored for their cleaning practices, you don't know that they're cleaning those surfaces where other people's bloody placenta has been. So you don't know about contamination. Now, let's forget about that. Let's pretend we have a clean, sterile, everything's good thing. There was a case, I think it's got to be a couple years ago now, of a baby in a NICU who got very sick from GBS infection. For those of you who don't know, it's group beta strep. It's a bacteria that's very commonly found in the vaginal area. It's very, very common. And for a lot of you, you may know, but around 35 weeks, we swab you and test you for group beta strep. If you're positive, we give you penicillin during your delivery to help kill off that bacteria, right? So that's what we do to help avoid your baby getting a group B strep infection. This is extremely important, okay? Group B strep infection, if left untreated, can actually kill a newborn. That's why we test everybody. If you don't get tested and you deliver early, we treat you and the baby. That we just assume you have group beta strep. And unfortunately, you can develop GBS after, but that's very rare. In this case, the mom had group beta strep. Her baby went to a neonatal ICU because the baby was sick after delivery. So while in the neonatal ICU, the baby received a full round of antibiotics and tested negative. Mom also tested negative after receiving antibiotics. The baby was in the neonatal intensive care unit for several weeks, like 4 weeks, I believe was when this happened. So baby's there, mom is coming in, and all of a sudden the baby starts to get sicker and sicker and sicker. And the baby's not doing well. So they start doing blood tests. And one of the things they do is they test the blood for a bacterial infection called sepsis, which they find. So they go to identify the bacteria, and it's GBS. The baby got GBS from the placenta pills. Mom's GBS was still in the placenta itself. When the pills were encapsulated, the bacteria was not killed. She was ingesting them, and that GBS was getting into her breast milk, and the baby was getting it that way. And that is my story as to why I don't think placenta pills are a good idea. So I encourage you guys to really research this. There's not a lot of evidence right now that shows that it helps with postpartum mood disorders. For a lot of people, for example, the anemia stuff, maybe it's the anemia factor that helps you, but you can absolutely get treated for anemia a variety of homeopathic ways, including through diet and nutrition. It doesn't just have to be pills. So I really think you guys should do your research, but this is still not in a place that we can say it's a safe practice. One of the few homeopathic things I don't like. I had a question about bottle feeding. Does bottle feeding cause any problems? My baby is just 2 months old. So this was a great question, very broad, obviously. And so I was kind of like sitting here and I'm like, does bottle feeding cause a lot of problems? So this is kind of one of those controversial things. So I'm going to say overall, no, bottle feeding is great. I don't know why everybody's so opposed to bottle feeding. Oh, and it doesn't matter what's in that bottle. It can be formula and it can be breast milk. Bottle feeding is great. Okay. The biggest thing I would say as far as problem with bottle feeding is all the bottles you have to clean. It's not really the baby. I would say the one exception to this might be if you're letting the baby like carry around a bottle in their teeth for 3.5 years, that might be really bad for their front teeth and they might need braces and stuff. But overall, like bottle feeding is just fine. But please do not prop feed your babies. So for those of you who don't know, prop feeding is where you put the bottle in the baby's mouth. You put a blanket or a pillow underneath so that you can just leave the bottle there and you can walk away from the baby. That's prop feeding. Do not do that. That is a risk for aspiration, choking, and that is not good for the baby, okay? But other than that, I don't see a reason why bottle feeding is so bad. I think bottle feeding serves a purpose for a lot of people, and we really, really shouldn't like down it. So that's what I'm going to say about that. Hi, Gabriella. How long can I take baby aspirin for? I'm 27 weeks, wondering when I can stop taking it. Depending on why you're taking it, you might take it all the way until you deliver. I'm guessing the reason why you're worried about it is because aspirin is a blood thinner. So I'll let you comment on that while I talk about blood thinners. So you don't want to take aspirin or blood thinners without talking to your healthcare provider. However, a lot of women are now being advised by their healthcare providers to take blood thinners for a variety of reasons. Baby aspirin is starting to be shown to possibly help prevent miscarriage. We're not quite sure the mechanism of action, but what they think is happening is that for some women who have repeated miscarriage, their blood clots off on the placenta very, very early on. And then that causes like the placenta to stop functioning, and then they people have a miscarriage. I'm taking it because it's my first pregnancy and my age. Okay. So and then there you go. First pregnancy and age, those are other good reasons for taking baby aspirin. So baby aspirin is super mild. It is a blood thinner. It kind of just keeps things really good, because during pregnancy, you are at risk for blood clots, because the blood is full of the clotting factors that help prevent you from hemorrhaging if you were to give birth early. Okay. So this is why sometimes we use this. I will also tell you that baby aspirin was part of the COVID protocol. So COVID-19 has a very high affinity to clotting. And so part of the things that we were giving COVID patients was baby aspirin in the hospitals. So unfortunately, COVID is still around. So for pregnant women who are at higher risk, taking a little bit of baby aspirin is probably also a pretty good idea for them. But we give women blood thinners for a variety of reasons. We give women Coumadin, usually, which is a pill. Now, Coumadin is a long-lasting blood thinner. And so what actually happens is we give it to them and we have to do blood work and stuff, but this is because they have significant risk factors for clots and embolisms and stuff that might put their life in danger. And then usually what we do is a couple days before we anticipate birth, these guys are usually either a planned C-section or a planned induction. We bring them into the hospital and we convert them over to something called Lovenox or heparin, which is a shorter acting blood thinner, so that if they were to deliver, they don't have all that blood thinner in their system, and therefore they're at a lower risk for hemorrhaging. Gabrielle, if you don't have any risks for preterm birth, my guess is they're going to have you take it to around 32 to 34 weeks. That's my guess. If you are at risk, if you have any risk factors that you might go into preterm birth, then you definitely want to check in with them and ask them, like, when do they want you to stop? And the last thing I'm going to tell you guys also is that, in case you guys didn't know, omega-3 fatty acids, which are fantastic for you, actually thin your blood as well. So if you're taking any omega-3 fatty acids, that can also do that. And the combination of the two can increase your risk for bleeding and for bruising. Advice for safe laboring at home. And what should I expect when I first arrive at the hospital? Okay, I love this question. Okay, advice for safe laboring at home. Okay, first of all, listen to your body and don't wait if your instinct tells you to go to the hospital. That's number one. I think too many people, they don't listen to their gut, and that's a very big thing. Our guts, our bodies are designed to do nothing but protect this baby for a major part of the pregnancy, okay? At the cellular level, remember, we are human beings, Homo sapiens. And if we don't deliver a healthy baby, the human species dies out. So at a cellular level, your body is instinctually trying to protect this baby. So if you have this fear, danger alert, listen to that gut instinct and go to a hospital. Okay. Now, as far as laboring at home, I would tell you, move. Do not lie in bed asleep. You can do plenty of that at the hospital when they try to keep you in a bed. Okay. Move as much as you can. Try to make sure that you're doing a lot of movements that allow you to open up your pelvis. Squats are a really good thing. Sitting on one of the exercise balls. For distraction, if you're really doing well, other than say discomfort or pain, you feel like things are going well, walk outside of your house, go to a restaurant, get into places where you're instinctually, as a human being, going to try to hide things, cover things up. Because when you're kind of in a safe space, private space, you can kind of give in to some of that pain and some of that discomfort, which of course eventually can lower our reserves. Putting yourself out in public, you're going to feel like a little embarrassed and stuff, which means you might be able to last a little bit longer. Eat, please eat. And then I would also tell you, just tons of distraction, tons and tons of distraction. Watch your favorite shows, talk to your friends, go bowling. Do something that keeps your mind off of this idea that you are actually laboring. One of my friends, when she was laboring, we went to a local kind of entertainment district. We got lucky. It was a Saturday night, so it was open until 3 o'clock in the morning. And we just walked back and forth. While all these nightclubs and all this other stuff was around us. And we just walked, this big pregnant lady and me, just talking and talking. Because we were just trying to get her through 3 or 4 hours of contractions. And that's what we did. We walked for 3 or 4 hours and it worked. So that's what I tell you. Now, Once you get to the hospital, if you get to the hospital and you're in a lot of pain, do not expect to get an epidural right away. In fact, you got to go in. You got to get checked in through like registration. Then you got to get into triage. In triage, they're going to check you and see if you're actually in labor. Then they're going to send you to a room. Hopefully they have a room. When you get to a room, you got to meet a nurse. The nurse is then going to admit you, which means she's got to ask you a whole bunch of questions, even if you're in pain. And then they're going to start an IV, and then they're going to get medicines. And then you might get an epidural, maybe. Oh, we've got to get orders from the doctor as well. Okay. So what are you going to expect? A whole bunch of bureaucracy. Okay. Unfortunately, it's part of safe care. I joke about it, but we do need to know about you. We need to make sure your doctor knows you're there. We need to know your health history, but there's a lot of check-in stuff. Okay. Once you're there, you're going to find out, we're usually going to start an IV. Please let us start an IV. I just did a birth plan video. Please check that out. That birth plan video talks about IVs. So we're going to start an IV and stuff, and then you're going to be in a room and in a bed, and they're going to want to be monitoring the baby. I encourage you to keep moving inside the room. Just because you're connected to a monitor does not mean you can't squat. It doesn't mean you can't sit on a belly ball. It doesn't mean you can't do a lot of things. But generally speaking, they are going to try to keep you in that hospital room at that point in time. The other thing I want you to really think about is, what are your pain options? Like, what are you thinking about for pain management? A lot of people make the fatal flaw that they wait until the very last minute. Please, if any of you didn't hear me talking about pain meds about 20 minutes ago, rewatch this video when we're done. But they will wait until the very last second to ask for an epidural. Just so you guys know, there's usually only one, maybe two anesthesiologists in a labor and delivery unit. So if that anesthesiologist is in a C-section, they are not calling another anesthesiologist from another part of the hospital. That is very rare. If there are 3 people ahead of you, there are 3 people ahead of you. Okay, this is not where, because an epidural isn't something you have to have unless you're having a surgery. So just understand, I'm not encouraging you to ask for an epidural early, but please be patient if you have to wait for your epidural, and try to make an educated decision based off of that information. So I hope that answered that question. It's 10 o'clock, but I am going to answer a couple other questions that I got that I thought were really good. So please feel free to stay on if you are interested in finding out next week's video. Okay, tomorrow's video. Oh my God, tomorrow's video. My baby is 1 month old. I'm usually using Nestle Good Start formula. Is it good, or do I need to change this? So Nestle Good Start formula is probably just as good as any other formula. And I don't mean that in a way like I hate formula. I don't hate formula. In the United States, formula is regulated, okay? Formula gets a lot of rap. We've had some bacterial contamination over the last couple of years with formula, which has caused some formula shortages. As many people know, it's a very scary thing. Ultimately, Nestle Good Start is a formula that's used. It's used in NICUs, in neonatal intensive care units. So it's not something we're using in hospitals. A lot of the WIC programs, they cover Nestle Good Start versus other formulas. I think if this formula is working for your baby, if this formula is something that you can get, you should be using this formula. Okay, now the only thing I'm going to preface is that I do have listeners from other parts of the world, and I cannot speak for sure about the formula in other parts of the world, okay? I'm going to say that if it is a formula that is sold standard in your country and is regulated by your government, then it is probably safe to use. But unfortunately, I can't say specifics for each country. But generally speaking, in the United States, Nestle is good, and I wouldn't switch it if your baby's tolerating it well. Can a mother be in labor without her water breaking? And how can a mother know when she is in labor without water breakage? So this is one that I would definitely refer you to my 10 signs of labor video. But yes, you absolutely do not have to have your water break in order to be in labor. In fact, most people don't go into labor by having their water break. Most of the time, the water breaks during labor, and just so y'all know, that's what you want, okay? If you can help it, if there's any way to keep your water intact, that's what you want. It makes labor less painful, okay? We were designed to labor with that water intact, if at all possible. So it's like a cushion so that the uterus isn't contracting down quite as much, because the first part of contractions is not about pushing the baby out. This is what we think, but that's not actually the first part. So uterus, cervix. Okay. Cervix should be long, thick, and closed. Now, obviously, a cervix isn't completely closed. This little opening right here, that's where your mucus plug is. So when you dilate, the mucus plug comes out. Long, thick, and closed. Okay. So here's our uterus, right? Here's our cervix. The first part of contractions is designed to thin out the cervix and open it up. That's what it does, right? So during this part, right, as this is thinning, you want to be in as little pain as possible, which means if your water's not broken, it's no big deal. Now, once this part happens and we're opening up, we're dilating, that's when we want the baby's head to engage. So once you're down, like you're at about 5-6 centimeters is when you want that baby's head to start engage, because it can help push this open to the 10 centimeters. So that's why we try not to break your water if we can help it. The other thing is, once your water is broken, you're on a time clock. At about 12 hours after the water breaks, we're going to start giving you antibiotics. At 18 hours, they're going to start talking to you about a C-section because they're worried about infection for both you and the baby. So absolutely, we do not want your water to break unless we can help it, because it gives you a lot longer time to labor. Cholestasis. I'm 39 weeks and 5 days now, and I started itching a few days back, mainly on my hands, not palms, arms, legs. No itching on the palms and soles. Do you think this might be cholestasis? So cholestasis is the buildup of like bile and other things from the liver. And it causes like this really bad itching and stuff. Cholestasis is often a sign that the liver's enzymes are rising. This can actually be a warning sign for preeclampsia. So this is why we take this very seriously. And left on its own, it can also be a serious medical condition. However, I would say when you're 39 weeks pregnant, it could be a variety of things, and I wouldn't worry about cholestasis. Cholestasis usually starts to present in the second trimester, not at 39 weeks and 5 days. That could be a variety of things. All right, guys, I think that is where I'm going to stop with this week's. If any of you have any last minute quick questions, please feel free to put them into the chat. Oh no, I'm sorry. I'm going to answer one more question. My wife has been bleeding for 10 days after her cesarean delivery. Is this process normal or is it dangerous? And does the bleeding expose her to anemia? So just so you guys know, whether you have a C-section or a vaginal birth, it is normal for you to bleed up to 6 weeks postpartum. Most people will stop bleeding after about 5 to 10 days. One of the things I do want you to know, if you're still having heavy bleeding at 5 to 10 days postpartum, and if your milk supply, your breast milk supply has not come in, if you're having supply issues, that is a sign that you have a retained piece of placenta. That is considered a very urgent issue that could lead to infection. You need to go back to your OBGYN. You will most likely need a D&C, a dilation and curettage. That's where they dilate the cervix and they scrape out the uterine wall. A lot of people don't realize that heavy bleeding and no milk supply is those two things together are that. And the reason why that happens is the placenta has to detach completely for the hormones to make milk to trigger. As long as there's a little piece of placenta there, your body still thinks you're pregnant and therefore you won't make milk. So just so you know. Then if you are still having heavy bleeding 10 days postpartum, whether it's a C-section or a vaginal delivery, yes, that puts you at risk for anemia. If you're having anxiety, if you're having heart palpitations, if you're having shortness of breath, if you're having excessive fatigue, you want to go back to your OBGYN and you want to ask them to do a blood test for anemia. If they are not available, if it's the weekend, something like that, you need to go to the emergency room and you need to get that checked out, because anemia means that you're not oxygenating well, and that can lead to other issues. You need to make sure you get that checked out. All right. So for those of you who hung on, tomorrow's video that's going to be coming out is how can you tell the difference between when a baby spits up and when a baby is vomiting? This is one of the biggest questions I get. It's very important for you to notice the difference, because I would tell you that like 99% of the time you guys call it vomiting, and probably about 1% of the time it's vomiting. So please check out that video tomorrow. I think it's going to be a great video. It's really a topic that a lot of people ask me about. My name is Dr. Samantha. I am the maternity mentor. I am here every Monday at 9 p.m. Eastern Standard Time to answer your questions, which I love to do. I love interacting with you guys. I love you guys to see my personality. This is something I'm extremely passionate about, and I hope that I help. We're also on Facebook, Instagram, and Twitter. Please follow us over there. Please share the channel with your friends and family. Please like and subscribe to the channel. It really helps me out. Hit the notifications button so that you can get notified of our latest content. We have more videos in the works. We will be here next Monday. Please feel free to join us. Please feel free to ask any questions live. Please ask any questions on the videos. We really love you. We really appreciate you. Thank you so much for all of your support. My name is Dr. Samantha, the maternity mentor. Bye for now.